A 42-year-old female patient, Amanda, comes into the emergency unit with severe abdominal pains, nausea, vomiting, and fever. These symptoms have been getting worse for a period of about a week, especially after having a fatty meal. What could this be? Hi, you are watching ED Files, and I am Dr. Thabo Mafa. Abdominal pain is one of the common reasons why patients consult at a hospital in the emergency unit. It could range from mild, moderate, to severe, depending on the cause for it. These cases may be seen in both males and females. However, cholecystitis is very common in females. And what is it? Cholecystitis is inflammation of the gallbladder, and in most cases, it is due to blockage of the cystic duct by a stone, and this would result in stasis of the bile and also infection. And what are the risk factors for this condition? In most cases, it is females, especially above the age of 40, obesity, rapid weight loss, pregnancy, use of oral contraceptives, and diabetes mellitus. What are the causes for cholecystitis? 90% of these cases are related to the presence of a stone within the cystic duct, causing obstruction, or even within the gallbladder itself. And this we call calculous cholecystitis. In other cases, there is no stone at all, and we call this acalculous cholecystitis. However, these patients in most cases look quite ill. There could be secondary infection from bacteria such as E. coli, Klebsiella, and Enterococcus, which worsens the condition. What are the other symptoms a patient can present with when they've got cholecystitis? They could start with epigastric pain, which later at some point cycles within the right upper quadrant of the abdomen. And this pain may sometimes radiate to the shoulder or even to the scapula of the same side. What are the possible findings you would have on examination? In the case of Amanda, her blood pressure was 123/86 with a heart rate of 102 beats per minute, but her temperature was 38 degrees Celsius. She had rebound tenderness or severe tenderness over the epigastrium and the right upper quadrant, and together with that there was guarding. This shows the severity of the tenderness. She also had a positive Murphy's sign, and this means that when you palpate over the right upper quadrant and the patient takes in a deep breath on inspiration, this would worsen the tenderness over that area. The patient could also have fullness over the right upper quadrant, or you could also palpate the presence of a gallbladder in that area. Some patients may present with jaundice, that is yellowish discoloration of the eyes. What are the differential diagnoses for this condition, or what are other possible conditions that can give you a similar picture? A patient with a liver abscess could present the same way, or gallbladder tumor, peptic ulcer disease, or gastritis, which is inflammation of the lining of your stomach. And sometimes patients with an abdominal aortic aneurysm may present in a similar manner. How do we then investigate this condition? We have to do bloods, and this would include infection markers, inflammation markers, liver function tests, amylase to check your pancreas, and also kidney function tests. And in 15% of cases, if you take these patients for a plain abdominal x-ray, you may be able to identify stones on the x-ray. However, the gold standard of investigation, which is 90 to 95% sensitive, is the ultrasound of the abdomen, And on this, you may be able to see stones or sometimes the thickening of the walls of the gallbladder. The patient might have a sonographic Murphy sign which is positive, meaning that on examination over the right upper quadrant, there may be severe tenderness on inspiration. If the findings are inconclusive, you may refer this patient for a CT scan of the abdomen. How do we then treat Amanda, who presents with symptoms and signs suggestive of cholecystitis? We had to put up a drip for her, give her medication for nausea and vomiting to prevent that, and that is antiemetics. We also had to give her pain medication. However, we have to try by all means to avoid using morphine, as this can either worsen or mask the symptoms. What it does is it can cause a spasm of the sphincter of Oddi, and this is a muscle that controls the flow of digestive fluids from the gallbladder and the pancreas into the small intestines. We have to make sure that we start her on antibiotics, especially if she's got high temperature, infection markers and inflammation markers are high, and there is no stone identified on the ultrasound. We have to have a surgical consult as soon as possible for a possible removal of the gallbladder. And now, what was the outcome for Amanda? She presented with abdominal pain, which was severe, with nausea and vomiting. And together with that, she had a spike in temperature of 38 degrees Celsius. On examination, she had a positive Murphy sign, which is severe tenderness over the right upper quadrant on palpation during inspiration. Her blood suggested that the infection marker and inflammation marker were high, and on ultrasound, there was no stone found, which means that this was acute cholecystitis, and there was thickening of the wall of the gallbladder, together with the presence of fluid around the gallbladder. We kept her nil per os, meaning that we advised her not to eat anything. We started her on pain medication and antibiotics with some medication to stop nausea and vomiting. We had a surgical consult as soon as possible. She was taken for removal of the gallbladder by the surgeons and thereafter taken back to the ward, where she made a good, speedy recovery. What if Amanda never came for treatment at the hospital? What could be the possible complications? She could have perforation of the gallbladder, and this can cause severe illness such as peritonitis, which is inflammation of the whole abdominal cavity. She could have empyema, and this is formation of pus within the whole abdominal cavity. These patients can have sepsis, and sepsis can be deadly. Some patients may not have any perforation, however, they could have a chronic cholecystitis. In conclusion, early recognition of the signs and symptoms of cholecystitis, together with commencement of treatment as soon as possible and early surgical consult, can save a patient's life. And thank you for watching. See you in the next case.